Today I'm talking with Marvin Lein, the CEO of Ben Memorial Clinic. Let's talk about healthcare. There's a lot of challenges in the industry right now as far as reformation. The term has been passed about that the system is broken and needs to be fixed as far as the sustainability. If something doesn't happen, there's going to be a problem because more and more people are, especially in this tough economic time, not able to pay their bills. What are you seeing at BMC?
You know, we've seen a small dip in our commercial business being anything other than Medicare and Medicaid. When it comes to how people are presenting, particularly in the urgent care facilities, we're finding people are delaying care. And when they do come in, they're sicker than usual, probably have 2 or 3 things going on. So on a clinical side, that's certainly concerning. Not the best way to deliver care. On the economic side, like I said, we're down about 2.5–3% on the commercial side of things, and that's of course tied directly to the fact that we have fewer employers out there, and fewer employers that continue to exist who can afford to offer health insurance for their employees. And buying it on the free market as an individual can be somewhat expensive, particularly if you're trying to insure a whole family.
Are you finding that more and more patients that are coming in don't have health insurance?
We're finding more and more people who are on the COBRA, so they've gotten laid off, but with the federal extension of the COBRA and the feds picking up about 65% of that cost, people are coming in on COBRA, but that's a limited time frame. They're concerned about getting all the care they can that's necessary in it while they're here and while they're covered, and that seems to be driving some of the folks.
Of course, President Obama is talking about a huge reformation of the healthcare system. What do you think of the Obama proposal?
Well, as with any proposals, I think it's a mix of things that are absolutely necessary, a mix of things that probably ought to take a closer look at, and then some things that may be out on the fringe in terms of what us as a society are willing to accept. So if you address the last one first, the idea of a single-payer system has strong proponents and strong opponents. I don't think that particular notion is going to come out of both houses and become a bill that the president can sign. We're going to find something in the middle. Appropriately, some reforms in the in the insurance business, making sure people have opportunities to purchase insurance even if they are sick, even if they have existing conditions, and so on and so forth. I think the marketplace needs some ability for consumers to compare plans with each other, have some standards. You know, when you go out and buy an automobile, there's a list of features, et cetera, that you can see on the sticker. You can take a look at the color and the interior, et cetera, make your decision. When it comes to healthcare, there are so many variations of vanilla out there that it's nearly impossible, I think, for consumers to make a good choice about what's a good value for what they're spending. And more often than not, they'll get into a plan that has a $2,000 or $5,000 or even a $10,000 family deductible and not realize that that's out-of-pocket expense for them. So I think standardizing some of the insurance ways of doing business is a good thing in the plan. Certainly, I think at the central core, if you will, of the Obama plan is to get more people on the insurance rolls. As people drop off of the insurance rolls, the risk to those who continue on insurance increases. The probability that you're going to pay out for those people increases. That alone drives up the price of insurance. So getting people back on the rolls is, I think, an excellent approach, and I don't think anybody can argue with that.
What do you think needs to happen?
I think in 5 years, we need to have some marketplace controls that would allow customers to be confident in what it is they're buying when it comes to insurance. That customers/patients can be confident that when they go to a provider, they understand the quality history of that particular provider. They understand what it is they're purchasing, what it is that the insurance is going to pay for. So making our system more transparent is something that we absolutely need to do. And then I think from that transparency, the marketplace has the ability to adjust and to meet customer wants and needs. Right now, there's so much that the average person doesn't understand about the healthcare system that I wonder how many folks are really purchasing insurance, knowing what they're getting, going to a provider, having confidence in the quality that they're expected to receive, and so on. I think more than anything, that needs to drive the system.
Marvin Lein, CEO of Ben Memorial Clinic. I'm Dave Adams. Take 5 is a production of 1110 KBND Radio News. Depend on us.